Hi, I'm Dr. Matthew Norton of People Plus Purpose, and you have discovered the Truth Behind Dentistry podcast. And today, my guest is Jaquette Green. Sorry. Jaquette is a registered dental hygienist and nutritionist, passionate about the mouth-body connection. Welcome to the podcast, Jaquette.
Thank you for having me.
Absolutely. It's my pleasure. So, we were chatting before we press play on this, just to kind of learn a little bit more about the kind of the reinvention elements of Jaquette. But first, I mean, I would love to kind of have you share with our viewers a little brief overview of your dental journey up to this point.
Sure. I'm originally from South Carolina and I graduated from hygiene school in 2009, and that was in Greenville, South Carolina. I ended up finding myself looking for other places to move to, and I ended up moving to Beaufort, South Carolina, where I worked on a Marine training base. I was there for almost 5 years as a contractor, and in 2014, which was a hard time for me, they end up doing away with the contract. I loved working on the
Mm,
military base.
mm,
My main goal was really just treating the patient. I didn't have to do anything extra. I just could clean the patient, teach them, educate them on the importance of dental health. So I was there for 5 years. And in 2015, I moved to Virginia and I'm still here. I've been here since 2015 and I'm temping now. I'm going to different offices in Virginia and DC.
awesome, awesome. So you found some things that you have loved along the way, and you're still in the midst of change and
Yeah,
growth, and that's exciting to me. It's who knows where this will all lead you, eventually, but it's exciting, right, to be on
it is.
a
It is.
journey like that. So I know that you have a passion for, as we talked about, nutrition and also the mouth body whole health connection. Uh, can you tell us more about what drives you in that, why you're passionate about that, and um, maybe a little bit about um, what that might look like ahead for you?
Sure. When I was in hygiene school, there was a nutrition course that we took, and something about that course, it got me excited just learning about nutrition. It was only one semester, but something about it sparked something in me, but I didn't know what it was. So as I got older, my parents got older, they also were getting sicker, and it was like things were coming to me about nutrition. So I ended up taking a nutrition course and finding out like things that I could try to do to help both my parents. They were both suffering with multiple chronic diseases.
Mm, mm,
So just to find out the power, the things that we can do ourselves to uh stay healthy. And not just, I'm not against a medication, but I know there's going to have to be some power that I put in far as like eating, sleeping, exercising, sunlight. There's a lot of things that we could do to try to make sure our bodies are operating at the optimal level. So I love nutrition and the power that it brings.
that's great. And there's a lot of people. I mean, I know that there's a growing movement of understanding the connection between oral health and how the rest of the body is functioning. But I still think there's so many people who have, even within the profession, that have not really explored that much in that. So what would you say for, you know, how you see the power of that connection, and then maybe your contribution? How do you feel like you have been or are heading into contributing to advancing that work?
Yeah, I know with a lot of different like nurses, hygienists, dentists, doctors, most people talk about there's only a small portion of their training that they learn about nutrition. So even though we're providers, we don't really know a lot about other things outside of the curriculum that we're taught.
Mhm.
So nutrition is kind of glossed over. So with us learning about the power of nutrition, and then like I think for me, it starts with your mouth. You need to have teeth in order to chew the food that can get you the help, or juicing if you don't have good teeth. But the power of your oral health, it can tell you if there's any problems internally. It I really feel like there should be more knowledge for us as providers to help the patients that we're really there to treat learn about things outside of what, like say cleaning teeth or treating teeth. We
Mhm.
want to educate them more about what they're eating, because we know, for one, sweets and things like that not only causes cavities, but it can cause diabetes,
Mhm.
different things like that. So to really educate the patients and to really try to help them live a more holistic life.
Yeah, that's good. I think that there's one of the challenges is in healthcare in general that there's so much siloing of expertise, right? People are, I know what I know and I do what I do each day, and there's other people who know and do different things, but we're not communicating well enough. And I think dentistry has been like in another category, like it's like the mouth is not related to everything else. It's private practice. It's different than a lot of the other medical or healthcare elements in the minds of people, but I think it's not so different. I mean, it's all so much more connected, and I really think breaking those silos down and saying we need to have more conversation as to how collectively we can help more people. And if we have a particular case, I mean, who else maybe should be involved in that? I think we're not, because I think hygienists specifically can have a much bigger role in with a focus on health. I think the nutrition piece is awesome that you've gone in that direction, um, because there needs to be a health advocacy there, not just how are those teeth doing, and so anyway, I love that you're going in that direction. If for those that are watching who might be thinking about being a hygienist, what would be some of your advice to people thinking about a career in that?
First, I would say please job shadow. Go to a dental office, a couple actually, or a few. Go to a few different dental offices and see the hygienist at work, because every office is different. I worked on the military base when I was like straight out of hygiene school, and it is completely different than working in private practice. And even on the private practice side, there's the private practice and then there's corporate. Corporate and private practice operates different. So I would say go to different settings and see what they like and things that they don't like, and actually talk to the hygienist, not just one, talk to a few of them, because
Mhm.
everyone will have a different experience, and just see if it's actually something that they want to do. And if it is, find a program, go ahead and take it and give their all. And one really big hint or tip I would say, if anyone does go and become a dental hygienist, I love an 11-12 Explorer. And the thing that I've noticed with going to different offices, 11-12 Explorer helps us to actually detect calculus so we can properly clean our patient's teeth. I would say get into the program and keep using an 11-12 Explorer. If you end up going out to a different office after you graduate, order some of those, because a lot of offices don't actually have that. And I think that's a very important tool that we need to actually properly clean the patient's teeth, or to actually feel where the calculus is so we can clean the patient's teeth. So I would say do your research. And if you do decide to do it, I know over time, once you graduate hygiene school, there's some things that may fall off, but I will really say keep with that tool, because patients see that you care. When they see or can tell that you're actually treating them and checking behind yourself and making sure that you're bringing their mouths to optimum care, they'll love you forever,
Hmm.
and they will actually floss too when they see
Ah,
that you.
ah, ah. an inspiration to flossing,
Yes,
even
yes.
better, right? That's right.
Mm-hmm.
So I like that recommendation of doing some research, right? To experiment around and find maybe where, maybe to confirm that that is a career direction you want to go. But even once clarifying that career direction, there are so many different, even in private practice, how many different doctors' offices, the relationship between the hygienist and the doctor would be different. The communication, collaboration, maybe across different offices.
Yeah.
Um, the what, maybe where you're free to go in education, maybe, and or to bring in something like we're talking about in terms of nutrition, or being even a little bit more of a health coach, which I think is kind of an exciting, like, not that you have to have a whole different practice model to do that, but even, you probably see yourself as somewhat of a health coach in carrying out your hygiene duties. So I think getting a broad view to find out what home would feel like for you. I think that's a great approach.
Yeah, for sure. Go around, check out different offices. Also, if they decide to go and become a hygienist, know that they are a provider. And I want to like empower them to know that if this is your standard, and if you go somewhere and they are not up to that standard, if they want to take shortcuts and things, there's everyone has a mouth and everyone needs teeth. So there's ample opportunity, and there's so many dentists who are looking for hygienists who will gladly take you on. So if there's a standard that they set, they don't have to lower it for no one. So I would say get out there, check out different offices, see what you like, see what you don't like, and stick to that standard and don't drop below it.
If you had one message for the doctors that are watching, in terms of their orientation to hygiene or to nutrition or to anything, what comes to your mind as far as a message to them?
For the dentist, the message for the dentist would be to take time for themselves. Dentists are hard workers. They are running a business. They're actually treating patients. So my message for them is to take time for themselves. Like dentists do a lot. Like I don't know. I know like on movies and things, someone say, "Oh, that's the dentist." They kind of brush over it like it's nothing. A dentist is a hard worker. So my message to them is to first take time for themselves to do self-care, take time off of work, don't burn out because they're needed. They're the leaders in the offices. So that would be my biggest message for them is to put them first. And when they put them first, it trickles down to everyone else.
Nice, nice. Thank you for that. Um, so one more question for you, and that's, I know that you kind of see yourself on a bit of an entrepreneurial journey. We were talking about reinvention before. Can you tell us a little bit about what that looks like for you out ahead as you are continuing in your hygiene work, but you have some other plans you're working on?
Yes, I have some big plans. I'm actually working on a startup that's taking a lot of time, and I'm trying to focus on that. But one thing that I'm doing currently is coming out with a guided journal for not just dental people. It's really for anyone, entrepreneurs, creatives, anyone who will need help and like to journal and things like that. So I hope to launch that within the next few months. And I'm also coming out with a podcast. So there's a lot of things going on, and I'm trying to balance between going from employee to an entrepreneur, which is a whole journey in itself.
Yeah. Well, congratulations on all that. I think I just want to say I'm proud of you that you are continuing to move forward and take on new challenges, There's always the risk of all of that, but I mean, you can't win without risking something, right? So that's exciting to me that you're doing that. I'm a big fan of ongoing reinvention and continuing to explore new territory. You want to say anything about the startup, where that's going, or it's best
Well,
not to talk about it yet?
so I'm working on, like, once I get this locked in, I'm not sure if you're familiar with this organization called Y Combinator.
Oh, yes. Okay. Yes, I know that.
So I sent in the application. I'm looking to hear back from them. I hope to get into their summer batch. And once I get into their summer batch, I will more openly share what the startup idea is. And hopefully you guys will see and hear more about it sooner than later.
Nice, nice. Yeah.
Yeah.
If you told us now, we'd have to kill us. So yeah, we don't want
I
that.
don't want no one to die,
Yeah,
so I'm gonna
no,
keep it
no.
to myself.
This is a health focused program. So
Yeah, living.
yeah. Well, I appreciate you being on with us. I appreciate your journey. I appreciate your passion for what you're doing and kind of the connecting of a few different pieces that often are not combined. So I think that that's really meaningful. For everybody watching who is going, yeah, I would like some more Jaquette in my life. Uh, what's the best way for them to connect with you?
On LinkedIn or Instagram, I am Jaquette Charday, and it's spelled JAQUETTECHARDAE at on Instagram or LinkedIn.
Okay, very nice. Very nice. Well, thank you for your time and being with us today. I've enjoyed our conversation.
Sorry, one more thing. So I did mention the podcast, and
Ah,
so you can check me out on the podcast. I'm launching that next week. The name of that one is Curiosity and Courage. That's the name of the podcast.
very nice. Very nice. That sounds intriguing. I will
Thank
like to check it out as well.
Please do.
Yeah. Okay. Well, thank you. I look forward
Thank
to
you.
our next time that we can visit, Jacquet.
Same to you.
So, for everybody, thank you for watching. Matthew Norton with the Truth Behind Dentistry podcast, and today our guest was Jaquette Green. And appreciate your subscribing and sharing and all of that. And we look forward to seeing you on the next episode. Thank you.